Hey guys, welcome to Respiratory 3260 lab videos. This video is to cover the basic oxygen therapy for neonates and pediatrics. So to begin with, again, as I normally do, I'm going to go over the equipment and then kind of talk about theory and application. So we have the blender. So this is what a pretty normal blender will look like. Let's see if I can get it off the wall and show you guys. So this is a pretty normal oxygen blender. What it does is we take our two oxygen air lines, such as you would use with any type of other respiratory equipment. It comes into the outlets here on the bottom, oxygen and air, whichever ones fit with the male and female adapters. Some of them will have a third port right here that is used for pressurizing. And then we have outlet here, an outlet here that you can attach flow meters to, and they just twist on with this nut right here. So this is just my personal preference when I'm setting up. I like to have my blender, and that is so that I can get basically the same pressure I would get from the wall, that 50 psi, that I would attach it into, but I can adjust my FiO2 on my dial to what I want. So that is why and where and why we would use a blender. We use these all the time in neonatal and pediatrics, so get very comfortable with this piece of equipment. So again, this is how I personally like to have it set up. I like to have one side with a 15-liter flow meter for resuscitation purposes, or if there is a bigger kid if you're working pediatrics. And then the other side I like to use for whatever modality I am on. So for example, this one is a 3-liter flow meter. You can see there's a little 3 right there. So if I need lower flows, I can have a little more control and kind of see what's going on. You can also attach another 15-liter if for some reason your patient is on bubble CPAP. So always have air and oxygen, that's a requirement. And most of these just stay right at the bedside. Okay, so that is our blender. One troubleshooting thing, sometimes in here it can gain pressure. So if you hear it whistling, what it's trying to do is pressurize and decrease the pressure. Because I remember the first time I heard it whistling, I kind of like borderline panicked. So a couple things you can do is disconnect and just give it some time, and you can get a different blender. They're everywhere when you work neonatal and pediatrics. So you can just replace it as needed, but it should be available to you. A few other things is a bubbler, which you guys all are familiar with a bubbler. This isn't necessarily required, but highly encouraged when doing oxygen therapy with some type of flow involved. It just helps because, as we all know, oxygen is a very cold and very dry gas. So by adding any type of humidity, we're going to help those little itty bitty noses get the relief they need. Okay, these are called tender grips. So with tender grips, this is how we keep the nasal cannula, just the normal oxygen therapy nasal cannula, applied to the neonate's face, to the baby's face. They're like a sticker. This side is sticky, like a sticker. And then you can lift these tabs here. And it's sticky in there, and then this is just a thin piece of plastic. You can place your cannula for your baby in the tegaderm, close it over top. It's best to have the little tab piece down is best practice, and then this will apply to the baby's face. Sorry, drop that. And that is how the tender grips work. The best placement I have found personally is to go straight across from the eye. So find the eye of the baby and kind of go straight across and put it right on the temple. That way it stays in really well, it's out of the way, and it doesn't bug their face, any part of their face. So that's a tender grip. These are also everywhere, so don't feel scared to replace these. Get new ones. change them out if you need to, because, oh, and another thing is sometimes if I have a little face, I'll cut it down so that it fits a little bit better. So you can cut down the sides here, or cut it in half if you need to, if you have a really little baby that's doing really well, just needs a little bit of oxygen, but these might be a little big for their face. So that's a few things on tender grips. Next, we're going to go to what is called the low flow meter. So this is something that will be pretty new. It hooks right into the wall. You don't use any humidity with it, and you can give anywhere from 0.01 liters to 3 liters of oxygen. So that's a very, very tiny amount, and you have this little window that you'll change and adjust.
Like a student nurse, right?
Thank you. Sorry. You can increase the flow to what the baby needs. This is babies that are doing really well. Maybe they're on their way home. We can send babies home on these that just need the tiniest little bit of oxygen. So yep, 0.01 to 3 liters. And then we just attach it directly to the adapter. Next is the tried and true nasal cannula. You guys know how to use a nasal cannula by now. Just a little difference is, unlike with the RAM cannula where we're worried about the occlusion of the nair, how we find the fit for nasal cannulas for both Vapotherm and for neonates, and just for nasal cannula, we're not really worried about the occlusion, the diameter. What I do measure it by is the septum here, is how far apart for my septum, because I don't want it to be too big and fit too far in the nairs, or be too small and kind of cause some breakdown on that nasal septum. So I go by with sizing where it would be most comfortable to prevent breakdown and fit in the nose. I go by the septum, whether I need a infant, I need an intermediate infant, preemie, neonate, pediatric, whatever size I might need. And then you don't put these over the ears, you just place it inside the nose and up over the head. Okay, the last thing for this video I'm going to show you, we're going to talk a little bit about modalities with Vapotherm. So with Vapotherm, you can use the same set of equipment, and I am going to just post my how to set up Vapotherm in with this class, and you guys have all probably set up a Vapotherm at some point. So with Vapotherm, you have an adult circuit and an infant circuit. The adult circuit will go up a lot higher. I think it goes up to 40 liters, whereas with a neonate or a low flow circuit is what it's termed, you can go anywhere from 1 liter to 8 liters. And that's the safety measure. Another thing is, again, flow is very beneficial. You're not going to cause major issues with extensive flow. So feel free to use flow to help with tachypnea, wash out dead space, help with work of breathing, and ease that baby's breathing. So that's the biggest difference, is the low flow one will go from 1 liters to 8 liters. And then I also will typically give a little bit higher temperature. So I will do anywhere from 35 to 37 degrees. And I try to keep it on 37 degrees. The higher the flow, the warmer I like it. The lower the flow, so if we have a baby that's maybe on 2 liters of Vapotherm, they might be on 35 degrees on the Vapotherm if we're having excessive right now. So this is what the cannula for the Vapotherm looks like. Super good, high humidity. I'm a big fan of Vapotherm for neonates. And again, I just size based on septum. Size that to prevent breakdown. One thing you guys might see is there are some high flow setups with only 1 prong. This would be for a baby that would have choanal atresia, which is one of the nairs is blocked, and that occurs in development. So in order to give flow through the open nair, we have one prong. And then then they would have to go have surgery to correct this. Circling back, the last thing I'm going to mention is with the 3-liter flow meter, you can go up to a roughly about 2 or 3 liters if you're working with a bigger kid, such as with RSV, more of a toddler, before moving to a high flow system, and still give them adequate flow to help with work of breathing and even just some stimulus to help them breathe. With a baby, a neonate, typically we go to 1 liter, and then after that we would move to a high flow system. So babies, 1 liter, and we can go anywhere from a half liter, 0.75, or 1 liter, and that just kind of helps add a little bit of flow. Nothing too crazy, but also is very beneficial. And then for a pediatric patient, you can go up to a max of 2 to 3 liters. So that is basic oxygen therapy for the neopeds. And thanks, guys. We'll see you in lab.